We have Dr. Andre Duin, who is a stroke neurologist from William Osler Health System. We'll be discussing tips, awareness, how to prevent the stroke. Dr. Andre, if you can give your introduction to our viewers, that will be great.
Okay, yeah, thanks. I'm Dr. Andre Duin. I am a stroke neurologist. I previously held the position as director of the West Greater Toronto Area Stroke Program. I'm currently a stroke neurologist at the William Osler Health System.
Dr. Andre, the stroke cases in Canada on the rise, and it can happen at any age. So what is the reason in Canada there are so many cases of strokes? What is the main reason for that?
Yeah, we all carry a stroke risk. Strokes occur from birth to death. So as long as we are alive, we are at risk of having a stroke. Certainly, the risk of stroke increases with age. And so with the aging population, we are seeing more strokes just from that perspective. However, lifestyle also impacts on stroke risk. The main risk factors for stroke includes high blood pressure, diabetes, cholesterol, being overweight, sedentary existence. So being able to control these risk factors will help us reduce the stroke risk. Unfortunately, we are in a situation where lifestyle, the modern lifestyle, the sedentary existence, the diets that we are currently consuming, these things do impact and increase the risk. I should say as well, smoking is an important factor for a stroke as well.
Doctor, how can one understand that they will be getting a stroke? So how to understand your stroke risk?
Yeah, well, it goes back to the old saying that prevention is better than cure. So while we all carry a stroke risk, we want to mitigate the risk of stroke by reducing or preventing it from the onset. And how could we prevent that? Well, we can reduce our stroke risk by understanding what our risk factors are. And risk factors, some of the risk factors are non-modifiable, meaning if as we age, there's an increased risk of stroke, we can't modify our age. But other things we can modify. For example, if we know that we've got diabetes, then that should be treated aggressively. High blood pressure, we should stay with our high blood pressure medications, have that monitored. Also, other strategies for managing blood pressure, such as weight loss or reducing salt in the diet and increasing exercise. If we have high cholesterol, that should be treated. Smoking should be discontinued. Regular follow-ups to our family physicians would also help to give an understanding of what our risk factors might be. There are some people that have a cardiac arrhythmia, so that's an irregular heartbeat, for example, atrial fibrillation, that increases the risk of stroke. So a thorough understanding of all our risk factors will help us to treat those individually and lower our stroke risk.
Doctor, can you give us some signs of stroke before the stroke happens? What kind of signs one can observe?
So strokes occur when a blood clot blocks a blood vessel. So depending on which part of the brain is affected, we can have different stroke symptoms. For example, patients might have visual disturbance, loss of vision or blurry vision, loss of speech, loss of the use of an arm or leg with weakness. There's a little acronym that we use, FAST, and it goes observation of the face. So is there any facial weakness? So F is for face. A, look at the arms. Hold the arms outstretched in front of yourself or a family member. If you suspect that the patient is having a stroke, then get them to extend their arms. If one arm is sagging, that could indicate that there's some weakness. Speech. Assess the speech. So speak to the individual. See if their speech is slurring or they're having difficulty pronouncing or getting the words out. And as well, T. So that's the FAST. Face, arm, speech, and T. T means time. Time is brain. And it's really important to, if you suspect a stroke, notify the ambulance services. Call 911, get the ambulance services on site. And they are, in Ontario and across Canada, the ambulances are in tune to where the stroke centers are, and they will expeditiously move the patient to the stroke center to have appropriate treatment on time.
Dr. Andre, it is said that with the stroke, time is brain. What does that mean, that time is a brain with the stroke?
Well, that's a big one. So time is brain. So what we know, and we've known this for a long time, is that we got to treat strokes very, very quickly, because the longer we wait, the more damage occurs. As mentioned, strokes typically occur when a blood clot blocks a blood vessel. That's a non-bleeding stroke. Strokes can also happen if a blood vessel ruptures and there's bleeding in the brain. If there's bleeding in the brain, then there's some treatment we can give, usually controlling the blood pressure. There are some products we can use in the emergency room to try to contain the bleeding. However, the majority of strokes are what we refer to as ischemic strokes. Those strokes, those are the ones where the blood clot is actually blocking the blood vessel, and those are the ones that we can do something about very quickly. And ischemic strokes account for about 85% of strokes. So what can we do? Within the first 4.5 hours of a patient of having a stroke and arriving to the emergency department, in that time frame, in the first 4.5 hours, we can use clot-busting agents to open up the blood vessels. And that would include agents. The most commonly used drug is called tissue plasminogen activator, or TPA. And there's another agent that's called tenecteplase that is now being used as well. These are intravenous medications that are administered in the emergency department, usually by stroke neurologists, and that helps, it goes through the bloodstream and it helps to open up blood clots. Coupled with that, we now have, over the last few years, we can reach into the blood vessels themselves through a catheter, get up into the brain and reach that clot and pull that clot out of the brain if appropriate. The use of the catheter for pulling the blood clot goes a bit longer. We can go to 6 hours, or in some cases 12 hours or even longer, depending on the scenario, but that it can be offered. Now, the importance of this. Every minute that goes by with a stroke, we lose about 2 million brain cells. 2 million neurons are dying every minute after the blood clot blocks the blood vessel. That's why we say time is brain. We want patients to be aware of the signs of stroke. We want family members or the patient, if they can do it, call the emergency medical services, patients to be immediately transported to a stroke center to have the opportunity to be treated with either TPA or with what's called embolectomy, which is clot removal, or a combination of the two. And that way we can give the patients the best opportunity for survival and less disability.
Doctor, is it correct that stroke patients, they are at increased risk of having a secondary stroke?
Yeah.
So is the statement correct?
Very, very much so, very much so. So it's one of the risk factors. So we mentioned risk factors: high blood pressure, diabetes, cholesterol, smoking, atrial fibrillation, that's a type of heart arrhythmia or irregular heartbeat. History of heart disease also increases your risk of stroke, and also having a stroke. Once a patient has had a stroke, their risk goes up by about ninefold. So there's a nine times increased risk of having a stroke as compared to the same age-matched control. So for example, a 60-year-old who's had a stroke would be about 9 times more likely to have a recurrent stroke than a 60-year-old who did not have a stroke. So the importance of that is that the patient who's had a stroke really needs to pay attention to all the vascular risk factors and treat those accordingly to lower the risk back to what it should be for age.
Doctor, I have a question about the baby aspirin. We have seen many people, they take baby aspirin without the recommendation of their physician or a doctor. Is that a good behavior, or they need to consult the doctor before they take a baby aspirin? Because baby aspirin is a blood thinner, and people see that to prevent the stroke, to prevent these kind of things, they take baby aspirin. And what is the reality behind this, or they should consult physician, doctor first before taking baby aspirin?
That's a very good question. So the data and the studies have gone back and forth on this for many years. So there was a time when we considered using a baby aspirin for patients who may have high risk. So they have risk factors for stroke. So they've got, for example, high blood pressure, cholesterol, diabetes, smoking. And we used to think that treating with a low dose of aspirin would help prevent stroke. More recent studies have refuted that. It appears that using the aspirin ahead of time does not make any difference. But aspirin using after the stroke, after a heart attack, helps to reduce the risk of vascular disease, which is recurrent stroke and heart disease. So in general, I do not recommend using aspirin if you've not had a vascular event. If you're uncertain, speak to your family physician. There are always exceptions depending on the individual clinical scenario, and that should be discussed with a physician.
Doctor, your final message to Canadians, how they can prevent the stroke, awareness about stroke, what message you want to give to the Canadians on this?
Well, prevention. You know, we mentioned the tips for for primary prevention, and the primary prevention is knowing your health risk. knowing whether you have high blood pressure, so regular visits to your family physician to have your blood pressure checked, your cholesterol checked, have a diabetes check, have your heart checked if needed. If you're increased weight, consider joining a weight loss program, getting some exercise. Sedentary existence, we want to reduce that and have people moving more. Also sleep apnea, which I haven't mentioned before, but sleep apnea, difficulty breathing, and apnea refers to awakening, a difficulty sleeping in an efficient manner. That is an independent risk factor for stroke as well. That is often seen with overweight individuals. So you want to monitor all of those factors to help reduce your risk.